Study Section 2. The pelvic floor, vulva, and vagina. Introduction. In this study section, we shall be discussing the pelvic floors, the muzzle, and the perineal body, and also the vulva and vagina. The pelvic floor is formed by soft tissues. The most important is the strong diaphragm of muscles through which the urethra, the vaginal, and canal passes through. The vulva is the term applied to the external female genital organs, and the vagina is a passage that allows the escape of menstrual flow, receives the penis and sperm during sex, and provide an exit for the fetus during delivery. Learning outcomes. At the end of this study section, you should be able to 1. Explain the functions of the pelvic floor and describe the muzzle layer. 2. Describe the perineal body. 3. Highlight the structure of the vulva. 4. Describe the function and structure of the vagina and the organs in association with the vagina. Functions of the pelvic floor. The pelvic floor or pelvic diaphragm is composed of muscle fibers of the levator ani, the coccygeus muscle, and associated connective tissue, which span the area underneath the pelvis. The function of the pelvic floor include 1. Supports the weight of the abdominal and pelvic organs. 2. Its muscles are responsible for voluntary control of maturation and defecation, and also play vital parts in sexual intercourse. 3. It influences the passive movements of the fetus through the birth canal and facilitates its exit from the pelvis during labor. The muzzle layers. This consists of superficial and deep muzzle layers. The superficial muzzle is composed of 5 muscles. The external anal syncytial encircles the anus and is attached behind the few fibers to the coccygil. 1. The transverse perineal muscle passes from the ischial tuberosity to the center of the perineum. 2. The bulb cavernosus muscles pass from perineum forwards around the vagina to the corporal cavernosus of the clitoris. 3. The ischio cavernosus muscles pass from the ischial tuberosity along the pubic arc to the corporal cavernosus. 4. The membranous symphytal of the urethral is composed of muscle fibers passing above and below the urethral and attached to the pubic bones. It is not a true symphytal since it is not circular, but it is close to the urethra. The deep layers is composed of 3 pairs of muscles, which together are known as the levator ani muscles. They are so called because they lift or elevate the anus. Each levator ani muscles, left and right, consists of the following. The pubococcygeus muscle passes from the pubis to the coccygil, with a few fibers crossing over the perineal body from its deepest part. The iliococcygeus muscle passes from the fascial covering, the obturator internus muscle, to the coccygil. The ischiococcygiosus muscle passes from the ischial spine to the coccygil. Between the muzzle layers and also above and below them, there are layers of pelvic fascia. This is loose areolar tissue, the tissue that fills up the triangular space between the pubocavernosus, the ischiocavernosus, and the transverse perineal muscle is known as the triangular ligaments. The perineal body. This is a pyramid of muscle and fibrous tissue situated between the vagina and the rectum. It is made up from fibers of muscles described above in the diagram. The apex, which is the deepest, is formed from the fibers of pubococcygeus muscle, which cross over at this point. The base is formed from the transverse perineal muscle, which meets in the front, and the external anal sphincter behind. The perineal body measures 4 cm in each direction. The structures of the vulva. The vulva. This term applies to the external female genital organs. Figure 3.1. It consists of the following structures. The mons pubis or mons veneris, mount of Venus, is a pad of fat lying over the symphysis pubis. It is covered with pubic hair from the time of puberty. The labia majora, greater lips, are two folds of fat and areolar tissue covered with skin and pubic hair on the outer space. They arise in the mons veneris and merge into the perineum behind. The labia minoral, lesser lips, are two thin fold skins lying between the labia majora. Anteriorly, they divide to enclose the clitoris. Posteriorly, they fuse, forming the forceps. The clitoris is a small rudimentary organ corresponding to the male penis. It is extremely sensitive and highly vascular and plays a part in the orgasm of sexual intercourse. The vestibule is the area enclosed by the labia minoral, in which are situated at the opening of the uteral and the vagina. Urethral office lies 2.5 cm posterior to the clitoris. On either side lie the opening of sperm ducts. The vagina office is also known as the introitus of the vagina and occupies the posterior 2/3 of the vestibule. The orifice is partially closed by the hymen, a thin membrane which tears during the sexual intercourse or during the birth of the first child. Bartholin glands are two small glands which open on either side of the vaginal orifice and lie on the posterior part of the labia majora. They secrete mucus which lubricates the vaginal opening. Blood supply. This comes from the internal and external pudendal arteries. The blood drains through corresponding veins. Lymphatic drainage. This is mainly via the inguinal glands. Nerve supply. This is derived from branches of the pudendal. The function and structure of the vagina. Functions. The vagina is a passage which does the following: allows the escape of the menstrual flow, receives the penis and the ejected sperm during sexual intercourse, provides an exit for the fetus during delivery. Position. It is a canal running from the vestibule to the surface, passing upwards and backwards to the pelvis. Relations. Knowledge of the relation of the vagina is essential for the accurate examination of the pregnant women and a safe delivery. Anterior. In front are the bladder and the urethra. Posterior. Behind the post of Douglas, the rectum and the perineal body. Lateral. Besides the upper 2/3 are the pelvic fasciole and the ureterals, which pass beside the cervix, while beside the lower third are the muscles of the pelvic floor. Superior. Above the vagina lies the uterus. Inferior. Below the vagina lie the external genitalia. Structure. The posterior wall is 10 cm long, while the anterior wall is only 5.5 cm in length, because the cervix projects at a right angle into its upper part. The upper end of the vagina is known as the vulva. Where the cervix projects into it, the vulva forms the circular recess, which is described as the four arches or fornices. The posterior fornix is the largest of this, because the vagina is attached to the uterus at a higher level behind that in front. The anterior fornix lies in front of the cervix, and the lateral fornices lies at either side. The vaginal walls are thrown into small folds that are known as ragae. This allows the vaginal wall to stretch during intercourse and childbirth. Layers. The lining is made up of squamous epithelium. Beneath the epithelium lies a layer of vascular connective tissue. The muscle layer consists of circular and longitudinal fibers. Pelvic fascia surrounds the vagina, forming a layer of connective tissues. Contents of the vagina. The vagina is moistened by mucus from the cervix, and it transudates from the blood vessels of the vaginal wall. The vaginal fluid is strongly acid, pH 4.5, due to the presence of lactic acid formed by Dodelarine bacilli. The acid deters the growth of pathogenic bacteria. Blood supply. From branches of the internal iliac artery, the vaginal artery, and a branch of the uterine artery, the blood drains through corresponding veins. Lymphatic drainage. This is via the inguinal, the internal iliac, and the sacral glands. Nerve supply. This is derived from the Lee Franca-Elzo plexus. Study section summary. In this study section, you have learnt that 1. The pelvic floors support the whole weight of the abdominal and pelvic organs, and it consists of deep and superficial muscle layers. 2. The perineal body is made up of the deep and superficial layers of muscles, and if muscles measures 4 cm in each direction. 3. The vulva refers to the external female genital organs and consists of 8 structures. 4. The vagina is a passage for escape of menstruation and an exit for the fetus during labor. End of study section 2. Thank you for listening.